Good morning and welcome to the MOOC platform. I'm Dr. Orsi, I'm an interventional radiologist working at the European Institute of Oncology, and it is a comprehensive cancer hospital in Italy. I'm being involved in the high-intensity focused ultrasound project since 2006, and today I would like just to share with you my experience in using this technology in the field of oncology. High-intensity focal ultrasound is very famous thanks mainly to the treatment of fibroids. This is thanks to the many different websites that has been already available in internet. There's been basically made by the many different association of patients that has been treated or want to be treated with a HIFU. This is an example of a patient with a huge fibroid here, as you can see before this MRI. This is one of the first patients we treated in 2009, and this is a perfect treatment. The patient was indicated to be resected, so the indication was to have an hysterectomy, but thanks to the HIFU, the patient maintained the uterus and she had two babies a few years later. If you look at in the literature, you can see that not only the benign disease can be of interest in the literature. As you can see, the blue columns are regarding the papers in the benign fields, but also oncology has been one of the main interests in the literature. As you can see, the red column, the interest is increasing year by year. According to the indications coming from the FUS Foundation for the United States, you can see there's several different indications coming between the conceptual issues and the reimbursed issue that can be considered amenable to be treated with a HIFU. But regarding the field of oncology, I will spend my time with you describing the two main important issues, the main important field in oncology, to my knowledge, that is liver cancer and pancreatic cancer that can be treated easily by using high-intensity focused ultrasound. How does it work? High-intensity ultrasound waves are focused into the focal spot that is called acoustic focal region. Acoustic focal region is the physical, virtual area that are created by the waves, and it is created by the HIFU transducer. The tissue at the focal spot is suddenly affected by different phenomena, and the area within the tissue affected by the acoustic focal region is called biological focal region, BFR. The three main factors affecting the tissue at the focal spot are cavitation, the radiation forces, and heating. The focal spot is guided into the target by imaging. We can use both ultrasound or MRI. In this particular case, we are using an ultrasound-guided machine. You can see here the pancreatic cancer here. Immediately before the treatment, and in the other screenshot, you can see immediately after the sonication, a white spot appears. That is the boiling cavitation appears in just one sonication. According to our knowledge, the three main effects at the biological level caused by mechanical energy coming from the ultrasound are the radial forces or shear waves. They are conducted by the high-power ultrasound acting on human cells, and they can crush and tear down the cells of the target area. Then we have the thermal effect. It is a very slow phenomenon, and it happens when the frictions and the actions among the cells can produce the heat. It is very common phenomenon we can achieve by using radiofrequency ablation or also microwave. The more powerful effect called cavitation is very fast, and it happens when cells being torn down and may generate microbubbles. Regarding the acoustic cavitation, it is important to know how powerful it is. It is the alternating reaction of compression and rarefaction of microbubbles, And cavitation may occur when the static pressure decreases below the steam pressure at the level of biological tissue, developing the hotspot. At the level of the hotspot, they will last less than 1 microseconds. We may achieve a temperature up to 5,000 Celsius degree. It is almost the same temperature of the sun surface, and the pressure between 1,000 and 2,000 atmosphere. So the tissue simply is destroyed. And this is what happened in the real life in our clinical experience. Cavitation may lead to tissue liquefaction. This is an example in breast cancer. This is the small breast cancer. This is an MRI that's been treated. You can see the MRI that after shows you a huge cavitated area. And this is the specimen after resection. You can see there is some necrotic tissue here, and there is a wall inside. And this is due to the cavitation and the tissue liquefaction. And this is what happened in pancreatic cancer. You can see here a huge pancreatic cancer at the head of the pancreas. This is a metallic stent palliating jaundice due to the bile duct that was affected by the tumor. And this is the sonication. You can see the white spot appearing during the sonication. It is very fast. This is a cavitation appeared, and this is a CT scan the day after. You can see the tumor is simply liquefied, and this is 3 months later that the fluid has been partially reabsorbed. There are many issues in favor to using high-intensity focal ultrasound in oncology. So the rationale for using HIFU in oncology is mainly due to the nominally non-invasive nature of this technology. So because there is a general trend toward more and more minimally invasive therapies within the oncology field, HIFU may have room enough for being used in this field. Another important issue is that by reducing the invasiveness of local approach, the clinical indications will be wider and wider. And moreover, HIFU does not rule out any further therapeutic options. So it means that we can treat patients with systemic therapy, we can treat patients with surgery, RFA, or microwave, even after HIFU has been done, because there's no toxicity coming from HIFU treatment. The target size is another very important issue. It is important to think about we may achieve better results when we are dealing with small lesions. So the algorithm is a little bit different than what happened usually in many different hospitals. I mean, usually we are leading local treatment in those patients refused by surgeons or oncology because the tumor is so advanced, also huge. In terms of efficacy, we know that a smaller tumor could be better treated by using local treatments such as high-intensity focused ultrasound. So the algorithm should be completely opposed. We should be involved in treating patients at the very initial stage, because this stage is the stage we can achieve the better results. Last but not least, management of clinical local complex situations may be done by using no-invasive options. Think about patients with advanced disease where almost nothing can be done because invasive, in order to palliate symptoms, we can use